started reading this book, and honestly, I was expecting something different. Welcome, digital pathology trailblazers. So today I'm going to be reviewing The Healing Art of Pathology by Dr. Marilyn and Catherine Gallaghan. Why did I say that I was expecting something different? So Dr. Bui is the past president of the Digital Pathology Association. So I was expecting something that was more connected to digital pathology, and I was expecting a pathology book. But this is actually an art book. So I was reading it and I was trying to reconcile my expectations with what I was finding in this book. And it took like half of the book for my switch to flip and actually appreciate the contents of this book. So let's look into the content table. So what will you find in this book? So the content includes, and these are the chapter, the role of the pathologist in patient care, art by patients and their families, art by pathologists, art in collaboration with pathologists, art by healthcare professional and their families, and art in healthcare. So if I would bother to read the contents, I would not be surprised. So that's on me, right? I would know that this was an art book. But actually, I'm very happy I didn't look, because maybe if I did look, I wouldn't have bought the book. So why I say it was good for me to read this book. I am a veterinary pathologist, and I am currently working in drug development support. So in my mind, I am contributing with my work to better human patient care, because I'm checking if the substances that are drug candidates are actually safe. But I work in the preclinical space, which often is regarded as the research and development, the science. I am far away from the part of pathology where pathologists actually diagnose patients. So this happens in clinical practice, but in the spectrum of drug development, it's going to happen later, not in the preclinical space where I am working. It's going to be when the drugs are already entering the clinical trials. So even though I feel like I'm contributing to that, it's like far away from me. And this book brought this patient that is going to be ultimately receiving these drugs closer to me. And I also read it in a time where several people I know were actually diagnosed with cancer. And these were scientists and people in the healthcare space who were familiar with cancer biology, with medicine, with the treatments. So on one side, we could talk about this disease as if this was a disease entity. On the other end, when I would learn about that, I was like, these are my friends. And it's not just a disease anymore. It's something affecting my friend, and it's actually life-threatening. So I had thyroid cancer when I was 21. And like from the medical standpoint, I knew nothing's gonna happen to me. I knew that the disease was not so advanced, and now I'm like 18 years cancer free. So this is like a distant memory for me. Then there were friends who were being diagnosed with cancer from my professional circle. And this book gave me the bridge and brought closer the reality of patients being diagnosed with cancer who do not have the medical background. And not that knowing the science behind it changes anything in how you feel. This is still something that can kill you. But there are people diagnosed with this disease every day who don't know what that is. And now cancer is not such a taboo topic. I have recently talked to Dr. Pernick, the author of the Pathology Outlines website, who said that he is advocating for better cancer treatment, better cancer care. And he walked me through the cancer perception since the 70s in the episode. It was fascinating. And I also recently interviewed Dr. Bui, who talked a little bit more in depth about this book in our podcast. So you're going to find these both podcasts in the description below. To me, this book brought me out of the bubble of the science and of the abstract aspect of my work, and showed me the side of the people for whom we are doing cancer research. So let me show you an example of what you will find in this book. This is art. Some art looks more like pathology, and you can see here in the background there is actually a pathology picture. This is from a patient diagnosed with sarcoma, but it is art that helps them understand and deal with their disease, understand what pathologists are doing, and how they are contributing to patient care. So this is another bridge building book. It's not digital pathology, and I don't know what I was thinking to expect this to be a digital pathology book, but this is definitely a bridge building book. Bridge building between the scientists and the patients, between the pathologists and the patients. This book is destroying silos, destroying the barriers between the medical professionals and those who are being treated. It enables dialogue, and when I was talking to Dr. Bui, she told me that in many pathology and medical practices, many oncology practices, this book is now in the waiting room, helping patients familiarize themselves with what this even is that they are going through right now. So I very much recommend this book to anyone who is working in the cancer research space. You can get this book on Amazon. You can see when I bought the book, February 21st, 2022, so over a year ago. The profits from the book that would normally go to the authors are being donated. So this is definitely a charity project helping bridge the gap between all the people involved in cancer care. So I'm going to leave the link in the description below, and if you're doing anything in the cancer research space, this book is for you. It might change your perspective. I hope it doesn't have to change your perspective as it changed mine, and at the same time I'm super grateful that it did, because otherwise I would still be sitting in my bubble looking for funny shapes in histology images, which I still do, but there is a lot more behind it.